Good morning, good afternoon, good evening, wherever you're joining us. I welcome everyone to this session of Gansett Congress 2023. It's been a very exciting couple of days so far. I've been in a number of sessions and I'm sure everybody's learning a lot. It's been an excellent learning experience. And to think that this is just the beginning. My name is Annette Akinsete. I'm Dr. Annette Akinsete. I'm a consultant public health physician and also the national director and CEO of Sickle Cell Foundation Nigeria. Sickle Cell Foundation Nigeria is in Lagos, the commercial capital of Nigeria, and it's about 30 years old. It's a not-for-profit organization. I've been the CEO for a number of years now, and we do everything concerning sickle cell, from prevention to the entire spectrum, to treatment, care, and support, and now even cure, because we have established a stem cell transplant center in collaboration with the Lagos University Teaching Hospital. So Sickle Cell Foundation Nigeria does everything sickle cell. So my life has been sickle cell for the past few years. I'm really excited and privileged and honored to be moderating this session. I thank the Gansett team very much. I also thank Gansett really for putting this Congress together, for bringing stakeholders in the entire IBD space, inherited blood diseases space, and for just that much needed conversation. So much needed conversation. We've been like in schisms in different corners, but we need to come together. And that's what Gansett is doing for us, for networking and for identifying those opportunities for collaboration and for also deploying what I consider superb technology for robust and seamless participation. So thank you so much to Gansett. Now, this session this afternoon, for me, is titled Strengthening, let me be sure what I'm reading. It's titled, beg your pardon, let me get the exact words. It's titled Strengthening the Infrastructure for Care and Treatment of Inherited Blood Disorders, Challenges and Opportunities for cross-disease efforts. Challenges and opportunities for cross-disease efforts. I could jolly well have looked on my screen. So, and I'm telling you, we do have an excellent panel to take care of this, to tease this topic for us very nicely. And we have three very experienced, excellent, knowledgeable, and very distinguished speakers. I have Professor Jean-Marie Dangu. He's a medical doctor, primarily specializing in histopathology, cytology, cytogenetics, and epidemiology. He's a very well-known person in his work in non-communicable diseases, NCDs, and in health diplomacy, leadership, and management. He served at the WHO Regional Office for Africa and is currently the acting WHO representative to the Republic of Zimbabwe. In several countries, he has coordinated the WHO teams for planning, for implementation, monitoring and evaluation of health policies and plans. Before joining the WHO, Professor Dangu held various positions in the academia and in the Ministry of Health in Senegal. He has published more than 140 scientific articles. In addition, he has undertaken professional training and continuing education in pedagogy, research methodology, communications, global health epidemiology, leadership, and management, among others. You see why I say we have a very distinguished panel today. So I welcome you, Professor Dangu. I also have with us today, Dr. Laure Joseph. She has been a hematologist in the Necker Hospital for Children in Paris, since 2015. Necker Hospital is the world's first children's hospital, founded as far back as 1802. Dr. Joseph specializes in benign diseases of the blood, such as sickle cell disease, and is in charge of pregnancy in women with sickle cell disease. Very important area because everyone aspires to that. Many women aspire to that. including persons with sickle cell. Necker Hospital is a reference center for this subspecialty. Dr. Joseph is also involved in bone marrow transplantation and gene therapy clinical trials, much needed. I welcome you very much, Dr. Lord Joseph. I'm glad to see that Dr. Phil Tompkins has joined us. Thank you very much for joining. Dr. Phil Tompkins is a behavioral scientist serving as a health specialist, a scientist administrator at the NIH and NHLBI, that's the National Heart, Lung and Blood Institute, within the Division of Blood Diseases and Resources, Blood Epidemiology, and Clinical Therapeutics branch. He's also a lieutenant commander in the United States Commissioned Corps with 15 years of experience. Dr. Tompkins will be serving as a project officer for the Sickle Cell Disease Sub-Saharan Africa Network. Before joining NHLBI, Dr. Tompkins served as a consumer safety officer with the US FDA, Food and Drug Administration's Office of Regulatory Affairs Biomedical Research Monitoring Program. I welcome you very much here, Dr. Phil Tompkins, but there's so much more to this very distinguished panel. If you need to know more, dear participants, reach out to, open up the website and you find all the information about our speakers. So we really welcome you all, our distinguished panelists, to this session. I'd like very much to set the stage today. I'd really like to ask Professor Dangu to help us to set the stage by sharing with us, what efforts, WHO's efforts on sickle cell disease in Africa, WHO's efforts on sickle cell disease in Africa, how the work done in sickle cell disease could be replicated in other hereditary blood disorders. So you'll be starting out, but then I'll turn it to Dr. Tompkins next to enlighten us, enlighten the entire Congress attendees on the project, the specific project of NHLBI, strengthening sickle cell disease research in Africa. Strengthening sickle cell disease research in Africa. That will take it to another level. And then I would like very much for Dr. Lord Joseph to sort of bring it together by telling us, sharing with us the situation in Europe and what are we looking for? We're looking for those cross-disease collaboration opportunities. That's what we'd like to share with us to bring this together in Europe. It appears that Europe is ahead of other regions in this regard. So there are some, that's to dear participants now, there's some housekeeping announcements I've been asked to share with you before we begin properly. And so here they are. First and foremost is, as you're listening to the speakers, kindly put down your questions or comments, note them down or save them. And then there'll be opportunities at the end to ask your questions of our speakers. And in the Q&A section, you could type in, or in the chat, or you could simply raise your hand using the raise hand feature, and you'll be called at the end. And also, your microphones have been disabled already, if you may have noticed, and that will be so for the entire duration of the webinar. If you'd like to ask a question, do so at the end, but like I said, using the chat or Q&A functions or raising your hand. Also, please note that for those or the persons who are not comfortable with the English language, the translation captionings, there's a feature provided there. And that's why I'm saying this is a superb platform. So you could also use that. Gansid has ensured that everybody will participate in a robust manner. And we've been asked to kindly use respectful language in our chats, no profanity, no inappropriate images or posts whatsoever, please. And then we keep our discussions and comments focused on what we're talking about and not any extraneous ones. So that will conclude all the housekeeping announcements I need to make. So at this time, I would ask that Professor Dangu, I'll turn it to you to kindly share the screen, and let's have the benefit of your presentation. Professor Dangu, please.
Thank you very much, Annette, Madam Chair. Good morning, good afternoon, good evening to you all from wherever you are. it's a real pleasure participating into this panel, sharing a few hints of WHO's efforts in strengthening care and treatment infrastructure for sickle cell disease, but also for other hereditary blood disorders. Allow me to express my appreciation to Akinsete for inviting me, but also my organization, to this very, very important meeting. Couple of seconds, I put my presentation in slide mode. Madam Chair, can you confirm that my presentation is on the screen?
It's on the screen. Please go ahead. You have an introduction slide.
Thank you very much. So, looking at the Global Burden of Disease report, we can see that sickle cell disease ranks in the 12th position globally as a leading cause of death in under 5s, while in sub-Saharan Africa, it is ranked 11th ahead of measles and malnutrition. Approximately 500,000 babies were born with sickle cell disease in 2021, and 75% were in sub-Saharan Africa. That can show the burden of the disease in our continent. And there is attached to it considerable morbidity and mortality, with 50 to 90% of patients in sub-Saharan Africa dying before their 5th birthday. In the other side, few organized sickle cell disease clinics are available in sub-Saharan Africa, offering comprehensive care. So what WHO has been doing in terms of strengthening care for sickle cell disease, but also for other hereditary blood disorders. We have been mobilizing the international community for the prevention and effective treatment of sickle cell disease, but also for other hereditary blood disorders. And we have been also facilitating linking, collaboration, and coordination of partners and stakeholders. We have been also advocating for an increase in allocated resources for prevention, the provision of adequate infrastructure, equipment, and medicines, but also helping shaping the research agenda when it comes to sickle cell disease. We have been also providing technical assistance for the development and implementation of national sickle cell disease policies and programs, including the monitoring and evaluation part of it. We also focus on improving access to newborn screening, also ensuring medical and psychosocial care for all those children who have been screened. Our focus was also on contributing to the capacity building of health personnel at all levels of the health system, but also collaborating and supporting civil society organizations in their actions aimed at raising awareness among the public and the authorities. So our journey to address sickle cell disease and other hereditary blood disorders started almost 2 decades ago in close collaboration with the UN headquarters, but also other UN agencies. In 2006, particularly in the African region, we developed a technical document trying to highlight the burden of the disease in the country and the need for immediate actions in all countries, but also at regional level. This was followed in 2008 by a UN resolution during the UN General Assembly, which took place in New York. And that resolution was calling head of state and head of government to tackle sickle cell disease as well as other hereditary blood disorders.
Yeah.
In 2009, there was also another UN resolution recognizing sickle cell anemia as a public health problem. Then we moved back to the region where there were several events showing how sickle cell disease and other hereditary blood disorders came as a priority, a health priority in the region. There was a regional strategy signed by all 46 member states, African member states, in the region, because at that time there were only 46 member states. It has increased to 47 later on. So that regional strategy came with priority interventions to be implemented by all countries. And in 2011, if you recall, there was that high-level summit on non-communicable diseases to be held in the margin or in the sidelines of the UN General Assembly in New York. So in preparation for that high-level summit, we gathered all ministries of health in the African region in Brazzaville to discuss what are our priorities when it comes to non-communicable diseases. And that was the first time we added to the list of non-communicable diseases, which are priorities for the region, and sickle cell disease was added. In 2012, also, there was another regional committee in Luanda, Angola, where all 47 ministers met, and they committed again to tackle non-communicable diseases, particularly sickle cell disease. As you can see, there were all other events, other documents, policy documents, which were discussed and published up to 2020, where in collaboration with the US Department of Health and Sciences, but also the World Bank, we met in the US to discuss and try to establish a global coalition for reducing sickle cell burden worldwide. Unfortunately, this coincided with the beginning of the COVID-19 pandemic, and the coalition couldn't do what was expected. And now this coalition has been resuscitated, and it's no longer called the Global Coalition for Sickle Cell Disease, but it's now the Worldwide Sickle Cell Disease Coalition. In 2020 also, we WHO, we signed an MOU with Harvard Medical School, particularly the Center for Integrated Science in Boston, to work on what we have called the PEN+. In the past, WHO issued the PEN, which is a package of essential non-communicable diseases interventions to be implemented at primary healthcare. And now with Harvard Medical School, we have developed another package insisting on 4 very important non-communicable diseases in which we have added sickle cell disease. And that package was presented at the ministerial meeting in 2022, and it was approved as the PEN+ strategy in the African region. That strategy will help decentralize the services offered for non-communicable diseases. And later on, we have also signed and worked with partners like Sanofi, like the government of Monaco, but also the Helmsley Charitable Trust. So as you can see, it was really a very nice journey trying to address sickle cell disease and also hereditary blood disorders. And I have summarized here, giving some specific actions we did in terms of obtaining national, sub-regional, and regional political commitments, in terms of implementing multi-sectoral programs for sickle cell disease prevention and control, with a great focus on primary health care and universal health coverage. We have also supported the strengthening of laboratories, diagnostic capacities, and also provided affordable medicines for sickle cell disease management and pain relief, as well as vaccination of all patients. I've cited here a few countries where our actions were made available, but it's not exhaustive. There are other countries. And particularly in terms of medicine, we have been promoting the use of hydroxyurea. I will not go through all the list, but let me go a bit quick so that I can share a few examples. I talked about the PEN+ strategy, which was adopted in Lomé in 2022. Now we have received a grant from Helmsley Charitable Trust, and this is helping us support a first batch of countries to implement that PEN Plus, particularly focusing on sickle cell disease. We thank you to Dr. Kunle from Nigeria, currently working in the East Mediterranean region. That we have been working on developing a guidance framework for centers of excellence in the management of sickle cell disease, as well as developing a sickle cell disease management guide for each level of care in the health system of our countries. Again, I will not go through the other things you can see here on the slide. Particularly, there was a set event during the regional committee when we launched a sickle cell disease regional campaign, focusing on awareness, but also focusing on the management of the disease. The following 2 to 3 slides are focusing on provision of quality, affordable blood and blood products. As we all know, this is something important in the management of sickle cell disease and hereditary blood disorders. Late in February 2020, we have issued this WHO Action Framework for blood products with those 6 strategic objectives you can see on the slide. It was also important for us to define some principles for a strategy to providing care for most of the sickle cell disease patients. First principle, primary health care. It's a matter of equity. We should decentralize the care to the point of contact of the population with our health system. We should also insist on national investments on primary health care to strengthen our health system. Capacity and infrastructure should be enhanced for primary care, but also care must be accessible, equitable, safe, of high quality, comprehensive, efficient, acceptable, and affordable, and delivered continuously and integrated into existing services that are people-centered and gender-sensitive. Last but not least, we should avoid fragmentation and ensure a functional referral system. So again, I would like to thank our colleagues who are supporting us, the experts from the African region, who have helped define 4 levels of care for sickle cell disease patients. The first level is, again, based in the community, the home, and the primary health care. The second level based in a secondary healthcare facility. The third level of care based in a tertiary referral teaching, general private hospital or equivalent. The last level of care is the center of excellence, and this is something where state-of-the-art facilities are made available. So based on this different level of care, we have also suggested a pyramidal management unit against the primary health care, the secondary health care, but also the tertiary health care. Finally, I would like to highlight few opportunities for collaboration and partnerships. First of all, joint programming and joint implementation of program. So WHO is keen collaborating with associations and alliances for the implementation of prevention, care, surveillance, and research program. Second, exchange of expertise. There is a great opportunity to share knowledge and skills between WHO and association to build capacity. We are also calling for multi-country alliances and eventually sub-regional and regional one. And last but not least, resource mobilization to support the implementation of our actions and interventions. I will not go through all these 11 intervention and actions we are proposing to build forward the sickle cell disease agenda, but we want it to be built differently, but better. So the slides are available. You can look at them. It's very, very interesting. And I would like, Madam Chair, to thank you all for your attention.
Excellent. Thank you so much, Professor Jean-Marie Dangu, for that brilliant presentation, and helping us to really set the stage regarding regards to what WHO is doing in the IBD space. I think I'll bring out. I have a couple of questions myself, so maybe I'll keep it as well until everybody's asking. Perhaps others will also have observed that one of those slides and asked the same question. But clearly, advocacy was one of the things, mobilizing international community, advocacy for in this space for sickle cell. And then towards the end of your presentation, I like that you brought out the levels, you defined how WHO has defined the levels of care. We know about primary, secondary, and tertiary very much, but now the center of excellence is another level. We'd like perhaps that you throw more light on that. Thank you very much indeed. And at this time, I will turn it to Dr. Phil Tompkins. Dr. Phil Tompkins. So you can talk to us about, speak to the Congress attendees about the project that you are involved in, the NHLBI's project, Strengthening Sickle Cell Disease Research in Africa. Strengthening Sickle Cell Disease Research in Africa. Yes, we see you're sharing your screen already. Thank you, okay. Tompkins, and your first slide is here, Sickle Cell Disease in Africa. So take it away, please, Dr. Tompkins. Thank you.
All right, thank you. So yes, today I'll be speaking about sickle cell disease in Africa. It's a funded project through the National Heart, Lung, and Blood Institute. So now, is the background, but I don't need to share this with you all, but, sickle cell disease is common in, Mediterranean, Middle Eastern, Caribbean, North, Central, and South American countries. More than 300,000 of these birds were estimated to have SCD, SS, and with 79% of them being born in sub-Saharan Africa. And then the most common types of SCD, with approximately 400,000 annual births globally. And then despite some sub-Saharan African countries being the hardest hit by sickle cell disease, they lack proper management and strategies due to the failure to implement national control systems and lack of funding and resources allocated to research. So NHLBI saw this as a problem and wanted to address this by funding the establishment of SPARCO, Sickle Pan African Research Consortium, which is coordinated from a hub in Tanzania. So SPARCO aims to develop research capacity for sickle cell disease through a multidimensional approach, which addresses infrastructure, education and training, provision of longitudinal research data, and then the translation of research into practice and the inclusion of new African sites through the Sickle Pan African Network. So our first awardee of the Sickle SPARCO Clinical Center Network was Julie Makani. She's a professor and associate professor at Muhimbili University of Health and Allied Sciences. And so once we established the clinical center, we also needed to establish a data coordinating center to facilitate data standardization, integration, and coordination across the three SPARCO sites, which were Tanzania, Ghana, and Nigeria. And Professor Ambrose Wonkum was the principal investigator for the Data Coordinating Center. Real quickly, so in phase 1 in sickle in Africa, the coordinating center, the clinical coordinating center and the data coordinating center interacted together and then provided leadership for the 3 sites in Ghana, Nigeria, in Tanzania. And part of that, the work that was done out of that interaction was the development of several working groups, the Data Management Research Working Group, the SCD Ontology, Skills Development, and Standards of Care Working Groups. And each of the working groups on the website, they have their own page and purpose and deliverables, and they update their progress is listed there as well. And here is the website page for sickle in Africa. This is the face page for the face page of the website, and it lists, you have the about people, working groups, resources, research protocols, pretty much any information that you would need regarding the network is listed there. So the accomplishments for phase 1, we developed SCD registries, and here listed were the current numbers at the time. And then we also developed and posted online harmonized phenotype definitions and ontologies. We prepared clinical management guidelines and also established skills development programs. So at the end of the first funding phase, leadership at NHLBI came back together and thought, well, the first phase went well, let's fund a second phase. So the second phase comprised of a limited competition for the Clinical Coordinating Center and the Data Coordinating Center, which are the first 2 bullets there. But we also, we also added a third bullet or funding phase for the Sickle Pan African Research Consortium collaborative sites, which increased the consortium size by 3 additional sites. So briefly, just the objectives of Sickle in Africa 2 was to describe the current status of SCD as well as risk modifiers, including access to care, clinical management in the countries. And then to follow SCD patients enrolled in the registry in participating countries. And then through cohort research studies to permit the evaluation of incidents of clinical events, the possibility association with various factors, including care management, such as infection prophylaxis, hydroxyurea use, as well as social, economic, and environmental factors. And then the impact of health outcomes of improving in the identification and care of patients with SCD. So here is a network picture of the consortium, the network in phase 2. In the purple there, we have the Clinical Coordinating Center and the 3 initial sites that were a part of the consortium. In the blue, down towards the right, we have the Data Coordinating Center. And then here are the 3 additional sites that were brought on through the last funding opportunity, the last bullet point on the previous slide. So they were Mali, Zimbabwe, and Uganda. So because the network has grown over since phase 1, we have two main groups managing the network. The first is the executive committee. And it's made up of 2 chairs. It is comprised of the PI of the Clinical Coordinating Center, the PI of the Data Coordinating Center, and then an HLBI, project officer, project scientist, and grants management. And so their responsibility is scientific management, leadership, and governance of the network. And so our 2 chairs for the executive committee are Dr. Fumi Alapade and Dr. Leon Shilo, who are doing excellent jobs of providing us leadership and guidance. In just remembrance of Professor Koff, he served as a chair for the executive committee, and is recently passed. But Koff was a tremendous help and assistance in the development of the Sickle in Africa program. So after the executive committee, we have the steering committee, and that's comprised of each of the principal investigators for each of the sites that are listed around the table. It also includes the chairs of the executive committee and then one NHLBI staff, which actually I just went over there. The main responsibilities, they're the main governing body, and they facilitate coordination and synergy across the entire network, recommend uniform procedures and policies, and ensure the awardees accept and implement the policies that are developed. So here is, so the network has a registry of sickle cell disease patients, and this is the most current number of patients that are registered. So it's about 31,000. And this is the disbursement across the countries for the sickle cell disease registry. And so the current research protocols, we have 2 that are well, one that's being implemented and one that's in the process of being implemented. So the newborn screening protocol has been approved and that's moving forward. And then the malaria protocol, the second one there, is in the process of going through the DSMB. So this is just so the malaria started, I think it was.
I'm sorry to mention, Dr. Tompkins.
Yes.
I'll kindly round up, please.
Yes. So I think this is my last slide. This is just an overall of the newborn screening recruitment, and it's just getting started. So that's what that is. And so that was the last slide. So thank you all. Thank you.
Superb. Thank you very much indeed, Dr. Phil Tompkins. for that presentation. Really shed light on what's going on in that research. Many of us know that is happening, but perhaps this is where we can also, draw lessons for this cross-cultural, cross-disease collaboration. So what's happening with sickle cell, we can do for overall inherited blood disorders. Thank you very much for shedding light on that. I'm sure there are many questions. I do see a number of questions, and so we'll take them once Dr. Law has had time. Dr. Law, please, I turn to you now to talk to us about
Thank you very much.
yes, what's happening in Europe, the experience in Europe, and how we can learn from that. Thank you very much, Dr. Law. Take it away.
Thank you very much. So I'm sorry. I'm Laure Joseph, so I'm working in Necker Hospital in Paris, and I will make the case for hereditary blood disorders and cross-disease effort in Europe. So as you know, and I will briefly talk about this slide, in 2006, the World Health Organization adopted two resolutions on sickle cell disease and thalassemia, which represented an important step forward for the recognition of hemoglobinopathies as a global public health problem. In Europe, that was the beginning for new projects to best treat these patients. The prevalence and impact of a hereditary blood disorder in Europe is well known, and in France we know that we estimated thalassemia patients with severe genotype around 600 and 700 patients with the national register. Concerning sickle cell disease, in 2016 the prevalence was estimated between 19,000 and 32,000 patients. And we know that every year in France, more than 500 children born with SCD every year. And just since November 2022, we start to systematically perform a newborn screening program for SCD in France, which was not the case before. It's a very important point. You can see the report for the justification of this systematic newborn in internet with this link. Around 20,000 patients with severe thalassemia in Europe, and the most important thing is we estimate between 28,000 and 48,000 people with sickle cell disease to live in the 11 states of Europe involved in the European reference network. I will focus my slides about this group because I think it's a very new, important group that will change the future of patients with hereditary blood disorder in my country. So according to the global burden of disease, sickle cell disease is, as we already see in other talks, one of the most common cause of disability among all hereditary blood disorder, and particularly anemia. So the European Reference Network in 2008 and 2009, the member of Europe called on to work together to pool their knowledge and expertise. And they want to determine specific recommendations to establish rare disease national plans or strategic programs by the end of 2013. You can find here the reference. And for these countries, some political and money concern are followed by a stop of this plan, and only 12 members of the Europe continue to work in this group. And the most important countries involved in this group are Belgium, Cyprus, Denmark, France, Germany, Greece, Ireland, Italy, Portugal, Spain, Sweden, and the Netherlands. This group do not cover only sickle cell disease and thalassemia and covers more than 450 rare hematological disease, encompassing oncological and non-oncological disease, and concentrates 103 multidisciplinary clinical teams across 24 EU member states and 10 European patient advocacy groups. Their principal actions are to pool expertise, knowledge, and improve best practices, and develop training and education programs. They want to harmonize clinical data to better know all the disease and to improve the management of the patients. They want to implement the Rare Anemia Disorder European Epidemiological Platform to more known incidence and prevalence of this disease. There is a new important thing thanks to ERN. It's a European Rare Blood Disorders Platform. It's for the moment, it's a project. It's not active in France and other countries, but the most important experts on sickle cell disease and other blood disorder are discussed together and decide to create this registry to better characterize medically and clinically the management and care of this pathology. And this registry is officially endorsed by the European Hematological Association. And the goal of this registry, as are already known, is to benefit from data for rare hematological disease with the only restriction to guarantee patient right and confidentiality. It's very important to respect legally concerned to be able to use the data for clinical research. Here it's the resume about the ERN action on sickle cell disease from 2017 to 2023. And you can see here the principal point to enhance this project. So they want to develop best practices recommendation. Actually, in all European countries, we have some recommendations specific to sickle cell disease, but there are no harmonization. So we want to harmonize that and do European recommendation. We want to highly specialized procedure to promote bone marrow transplantation and gene therapy, for example, and to harmonize transcranial Doppler during childhood. We want to train the medical and biological specialists in sickle cell disease to improve the management and harmonize our practice. It is very important to promote patients' education and empowerment to improve the care of this patient and to improve the quality of life of this patient too. There are some points that I'm not sure I have the time to talk about, but it's very important to develop preventive program for example, newborn screening in all countries in Europe, and it's not the case for the moment. We need to improve patient registries and harmonize the data collected in these, and we have to give money to help physicians to have very good registries and I think it's a very important point, because now some doctor has to themselves implement the registries, but it's not possible to have very good registries in the future. We have to promote research for this important disease, and we have to develop, and it's already the case in France, but I'm not sure it's the case everywhere, to develop center of expertise for this rare disease. and in this case for sickle cell disease. So in conclusion, I will focus on 3 points. It's very important to extending systematic newborn screening in Europe. And now this newborn screening is only available in Belgium, France, Germany, Spain, and the Netherlands. We need for collaborative efforts for effective management. It's very important. In Europe, and I think around the world, with Africa and with the US, I think it's very important, and Canada, to develop some collaborative study to improve the management of patients. The role of policy and advocacy in improving the landscape for hereditary blood disorder is a very important point. And we need all dedicated SCD action plan, and for other rare disease, but SCD is very important for this rare disease. And we need to ensure equitable care and align our resources with our ambitions. I want to insist with the creation of supportive environment for affected individuals and families, because it's a very important, this disease have a very important impact on quality of life. And I think we need to develop some help for patients. And I want to conclude with that. I think we also need to continue our fight against racism, prejudice, and discrimination, because I think for all these pathology, it's 3 very important points that we need to fight again. Thank you for your attention, and I will take some questions. Thank you.
Yeah. Thank you so much, Dr. Joseph, for that excellent presentation. Like I said, in a way, this ties our presentations for today, ties them together. At the end of the day, we're looking at what we can learn from what's your situation in Europe, for other regions. But I do have a question. Okay, before I open the floor for questions for everyone, for all participants, we have a few minutes for questions and we'll address them. Please note that there's a polls feature. So you can please fill out or complete the polls right after we answer the questions and address the comments. So that's to all participants. And so the floor is open now for questions. There are some already in the chat feature, in the chat box. I'll take them. But let me just start quickly with Professor Dangu. Very quickly, mine is just to ask, perhaps you need more data from Nigeria, because I see that the map of Africa does not place Nigeria at the top of the burden in terms of new diseases, new cases. Maybe it's a newborn screening issue, but kindly throw light on that. That's one. Then my question for Dr. Tompkins will be, how do we move this consortium research, Dr. Tompkins, Dr. Phil Tompkins, for sickle cell, and expand it to all the inherited blood diseases? Do we see that in the foreseeable future? Do we see it happening? Because with GANSI, that's what we're looking to doing. How can we move from the experiences here to broadening it to cover or encompass all the IBDs? And I have a number of questions, but I'll keep them one each. And then lastly, for Dr. Laura Joseph, okay, I'm so glad that you described all the issues that we need to address. We have always had them, but the way you put them together. And I find also that newborn screening is a recurring decimal. I think Professor Nadu is here somewhere. Newborn screening. If we don't go away from this conference with anything, we go away with that, the importance of newborn screening, and then how it helps us put this together. And I like that you brought up the issue of discrimination, Dr. Lord Joseph. Absolutely important. So let's take that away as lessons learned from here as well. So yeah, those are my questions for Dr. Lord Joseph. And then okay, also the rare. When are we going to stop defining some of these IBDs as rare? Because I think that will be linked with reduced funding and even political will. So when we consider things that are rare, so it's not really a public health problem, if you like. So please help us address that as well. So, and the question, okay, these are comments. I see some comments on the chat box and the Q&A. Let me expand my. Okay, so let's start quickly with Professor Dangu, please. Take it away. Thank you. My question while I address.
Thank you very much, Annette. You are absolutely right. That's why I didn't comment on that map.
Okay.
I've put a note there that Nigeria and DRC, the Democratic Republic of Congo, are the two countries with the highest frequencies, with more than 2% of newborns affected. So it's there. The map is an old one, but I've just put it there. So you also alluded to our work on advocacy. You know, we started a long time ago. It was, we worked a lot with the Association of First Ladies on the continent, and the First Lady of Congo was the first champion for sickle cell disease on the continent. She even was invited during the UN General Assembly in New York, the first one, which adopted the resolution. There were also the First Lady of DRC, Democratic Republic of Congo, the First Lady of Senegal as well. In terms of advocacy toward governments also, we use the channel of the Ministers of Health. And for a couple of years now, during all the gathering of the Ministries of Health, we have tried to raise awareness around the disease, but also to get them committed to raise the priority of sickle cell disease into their health agenda in countries. So this commitment, we wanted them to be explicit, not just saying, yeah, we are committed. No, we want explicit commitments. For example, providing a budget line for genetic disorders, including sickle cell disease. Yeah. There was also a question from my sister, Obi, on the chat. So yeah, she was asking how best the high burden countries in the region can be part of the PEN Plus initiative. Yeah, they're already there. They're already there. We are targeting 20 countries in the region. I can give you quickly the list of those countries. It's Ethiopia, Tanzania, Mozambique, Zambia, Zimbabwe, Uganda, Kenya, Namibia, Nigeria, etc. And they're all there. But we will be going, supporting them in a stepwise manner. It's not all of them at the beginning. We have targeted first the ones which were involved in the pilot testing of the PEN Plus strategy and the PEN Plus package. And then we will bring additional countries into the initiative. So that's what I can say. We are running out of time. Thank you very much for the questions, and thank you very much, Annette, for your leadership.
Thank you very much. Thank you so much. I think you addressed what we really needed. Dr. Phil Tompkins, what do you say about my question or comment?
Let's say yes. It's just, you know, speaking from a representative of a funding organization that would just take the funds to do it. But yeah, those are all important issues. And you know, speaking, yes, it would just take the funds to do it. So.
Okay, I agree that we have to move to learn from sickle cell and broaden it to all the other IBDs. Excellent. Right. Dr. Laura Joseph, what do you say about these rare diseases, please? Because there's a comment. Why can't we stop referring to them as rare diseases? Are they still rare with all, even in Europe, with their migration and immigration? You know, is it still rare? And how does that affect political will and funding?
I agree that rare disease for sickle cell disease is not a very good word because the frequency is so high. But I think for Europe and France, it's very important to keep this term of rare disease because we have more money, more help to improve the management of this kind of disease because we have specific plan for that. So I think it's important point to insist that yes, it's frequent, but it's compared to diabetes or other pathology like cancer, it's still a rare disease in our country.
Thank you for addressing that. There's a couple of questions I'll take here in the Q&A. Hydroxyurea is not widely used because of need for monitoring of FVC, food blood count, and LFTs. Can sickle cell centers take up this role to enable more widespread usage? This is a lady from Efe, I believe she's Nigerian. Perhaps I'll call on Professor Nodu to answer this question in the chat box too, if you can. And then someone is asking if there are fellowships or training opportunities for these hematological disorders, and who's best positioned to answer this? I guess anyone can take it away. Perhaps WHO, are there training opportunities or fellowships that you know of? Professor Dangu?
We organize some trainings, but it's just like continuing education. We are not providing initial training on those diseases.
Yes.
And our sponsorship now is very limited for those going to the academia to learn. So that's what I can say.
That's correct too. So I hope that answers that question. And then someone says here that newborn screening is not yet widely available in Nigeria. Dr. Akinsete, what are your thoughts about this? Again, Professor Nadu, please help me respond to this question. I think you're best positioned for many reasons, which we cannot discuss at this forum. We can take that outside of this forum, but there are many challenges in Nigeria. Nigeria is a massive country and massive population. So that's just one of the challenges we have. Okay. I think time is fast spent. 3 minutes beyond our time. So I'll take it now. I assume everyone has answered their polls, questions. And so it's left for me to say thank you to all participants for being part of this session, and a wonderful, wonderful panel. You did justice to the topic in a very short time, and beautiful, fantastic Gansett for putting this together. And like I said, deploying this superb technology so we can have robust participation and yes, excellent, seamless and robust participation. Thank you, Dr. Laura Joseph, Dr. Tompkins, Professor Dangu. Over to you now, Larry. Thank you.
Yes, if I may join Dr. Annette in thanking everyone, the great panelists. We've learned so much from you and our participants. Thank you so much. If you have any other questions for the panelists, please email us at info@inherited blood disorders. We'll be able to get those questions to them and get you the answers. Now we have another session that is starting now, Industry Alliance Symposium. This is bringing industry and the clinicians and patients together in a candid discussion on how do we access innovative therapies, even in low and medium resource countries. If you like, please use your FeedLoop link and join us. Thank you so much. Somebody's asking about the email address to send questions to. So please, folks, express questions. People have more questions. So I'll put it in the chat box. And
exactly. Thank you.
And thank you so much, everyone, again. And see you on the next session.
Thank you.
Thank you very much.